Use it or lose it. That goes for brains as well as muscles, and it's important as we get older. Dr. Kevin Duff is a neuropsychologist with the University of Utah Healthcare, joining us today on Studio 5. Keeping a sharp mind, we get these cognitive skills, as you like to call them. What happens to our cognitive skills, to our mind, as we get older in age?
Yeah, unfortunately, many of our cognitive skills, including things like memory or attention or problem-solving skills, tend to decline as we get older.
It's not just like a stereotypical thing where we say, oh, I'm getting old, I must be forgetting. It really is something that physically is happening, right?
Definitely. There are three things that kind of affect our cognitive abilities as we get older. One is disease. Things like Alzheimer's disease, stroke, or even depression can lead to declines in our mental sharpness. But it can also be due to just normal wear and tear. As we get older, like any other muscle, it starts to get weaker. And the third reason that we can experience some cognitive decline is just from lack of exercise, from not using those muscles, the brain muscle, the same way that we did when we were younger.
You hear people talking about when they retire and they don't have as much occupying their mind,
right,
that they start to lose some of that. So the key is to stay busy and keep your mind working, right?
Exactly. When we're younger, I think there's a lot of day-to-day activities that engage us cognitively, whether it's work or raising a family, managing a household. Those are all complex tasks. But as we get older and our lifestyle changes and we retire, or maybe we're empty nesting, we have less of those challenges, then cognitive decline can occur.
Three areas we're going to talk about, these cognitive areas, and the first one you want to talk about is physical activities. We saw some people lifting weights, just getting out, going for a walk. That helps things?
Definitely. It moves the blood around, it gets nutrients and oxygen to the brain, and so physical activity definitely helps.
Is there a purpose to walking backwards? Does that help things too, you know?
Well, more challenging cognitive tasks, definitely, physical tasks can definitely lead to more stimulation.
Okay, so that's one of the first things to do, is to keep things going, get some physical activity, be moving out there, doing some moving activity. Another thing is just sort of cognitive or mental skills to keep that going?
Sure, mental activity, whether it's something more formal like taking a class at a community college, or something more informal like crossword puzzles or Sudoku, or even helping children or grandchildren with homework. Any of those activities that get us thinking, the mental activity going, can be really good to stave off decline.
So it's not just so much getting out going for a walk. You can be inside sitting down and enjoying this stuff, but keep the mind going mentally.
Correct. There are actually some computer programs that you can use that challenge the mind to train it to be more active.
Okay, another area. We've got the physical, we've got the mental. Social is really key.
Definitely. Interacting with other people forces us to communicate our ideas, to try to get messages across to other people. Planning a dinner party for your friends puts a lot of cognitive stress on you, but it also is good for the brain.
So good social skills. Now we've talked about all three of these, but you say the real key is to do like sort of a cross-training, like we would do cross-training in physical activity. Do all three, incorporate all of them?
Definitely. Some of the ways that you can maximize some of these cognitive exercises, first is kind of gradually increase the demands across time. Just like if you were starting to walk. Initially you might walk a half mile, but then with time you might increase that to a mile or more. You want to do the same thing with cognitive activities. Start small, but then gradually increase. Also cross-training, using different cognitive activities. Maybe crossword puzzles someday, interacting with friends others, and maybe attending a meeting or the theater on another day. And then lastly, if you can combine all three, you get more benefit. And a favorite example that I like is that there was a study that showed that people who were learning to square dance staved off cognitive decline more than others. And square dancing, I don't know if there's anything magical about that one activity, but it involves physical activity, cognitive activity as you learn new steps, and you really can't dance alone, so social activity as well. So combining all three is definitely a benefit.
Who would have guessed that square dancing was the key to staying active as you get older? Thanks so much for letting us know about all this stuff. If you'd like more information out, you can check out the website at the University Center for Alzheimer's Care, Imaging, and Research. We'll have a link on our website as well.